One of the common questions asked is it possible to carry out heavyweight lifting after arthroscopic shoulder surgery? Shoulder is the most important joint when the person is doing weightlifting. After arthroscopic shoulder surgery, for conditions such as Bankard's repair, slap tear, rotator cuff repair, the recovery from the surgery is almost full and complete within 3 to 6 months. So, if patient does arthroscopic surgery and proper physiotherapy and rehabilitation, heavy weightlifting in graded manner can be started at the end of 3 to 6 months and over a period of longer duration. For example, 1 year, patient can start lifting heavy weight. In case there is a very complex problem and it cannot be completely resolved with arthroscopic surgery, patient will be advised to avoid lifting heavy weight. So yes, heavy weight lifting can be carried out after arthroscopic shoulder surgery. Thank you.